After pressing pause earlier this year, Ontario Premier Doug Ford announced today his government is moving ahead next year with some funding cuts to cities and towns in the province. This spring, Ontario announced cuts to money it gives cities and towns for public health services, which mayors warned would mean less funding for services like kids' breakfast programs, vaccinations, and water quality testing.
There should have been an indication on the part of municipalities that they would be expected to play their part too.
The province also planned cuts to childcare and land ambulance funding. Municipalities cried foul, saying they hadn't budgeted for those cuts.
I don't have residents banging down the doors saying that they want less services.
The City of Toronto calculated the cuts would have cost that municipality $178 million this year.
Day after day, night after night, weekend after weekend, more letters and envelopes and emails and smoke signals come out of there saying that there's cuts to everything.
After defending the cuts for weeks, the Ford government reversed the move.
We came to the conclusion there's savings, but they need more time. So we'll work with them, and at the end of the day, the taxpayers are going to be better off.
Today, Doug Ford spoke to Ontario mayors, and the province says some of those cuts are still on the way. Come January, municipalities will have to pay 30% of public health care costs and 20% of the cost of creating new child care spaces. Other administrative costs are being put off for at least another year. Though those details were revealed today, there are still a lot of questions. Are bigger cuts, for example, still on the horizon? And how much money is actually in dollar-for-dollar sense being cut? Steve Clark is Ontario's Minister of Municipal Affairs and Housing. He joins me from the Shaw Centre in downtown Ottawa. Hi, Minister Clark. Nice to see you again.
Hi, Vashi. Nice to be on the show again.
Minister, your government appears to be lessening the hit municipalities will take next year. Instead of, for example, a 60-40 split on public health costs, the province will take on 70% this year, municipalities 30%. Is the goal, however, still a 50-50 split by 2021?
You know, Vashi, I think what the Premier and I did back in on May 27th was we wanted to hit the pause button for this year and have an opportunity to engage municipalities. What Minister Elliott said today regarding the 70-30 split is in addition to the fact that we're still going to be meeting with our municipal partners. We still have set up technical roundtables to talk about how the system will transform. So there's lots of consultation to come and lots of discussion to come.
I take your point on the consultation, but that doesn't really answer the question. You were explicit prior to that May 27th in saying that, you know, the end goal was a 50-50 cost sharing agreement. Is that still the end goal?
You know, the goal is to have a system that's effective and efficient, and what we're trying to do is to allow municipalities exactly what they've asked for. They've asked for either money or time to be able to work with us for those improvements. So the announcement today was for only 2020. It dealt with that 70-30 guarantee. So many municipalities who obviously have existing agreements around 70-30 will see no change. The most that a municipality will see reduced is by 10%. But the most important thing is we'll continue to work together. And the one thing that I've learned since May 27th is there's incredible political will out there by our municipal partners to sit at a table with us, help us try to meet some of our fiscal goals, but at the same time provide good public services to their taxpayers. And I think we've accomplished that today.
So is it fair to say that nothing is determined, nothing is set in stone for 2021?
Well, we've made it very clear to our municipal partners. And listen, we had a historic opportunity for the Premier to sit at the AMO MOU table. He said very clearly today before the delegates that he wants to work with them, that he wants to have a collaborative tone. We want to listen to them. And we've heard the message that in a challenging fiscal environment, they want to work with us. But at the same time, we need to give them time. We need to give them time, and we need to use their talents at the municipal level to be able to transform some of these public services. And in addition, using emergency services as an example, we're actually increasing money. We're giving them 4% more for land ambulance as opposed to the 0% we offered them, in May,
which amounted to a cut for them at the time.
So it's not. But we've guaranteed them today, Vashi, that there's going to be 4% more this fiscal year and more next fiscal year as well. And in addition, they're going to work with us on some of the dispatching issues that they identified that they could help us with efficiencies and savings.
We've heard from both Ottawa Mayor Jim Watson and Toronto Mayor John Tory, who said that they're looking for the specific details. When will your government convey exactly what that 70-30 split means in dollars? Like, when will they know, for example, X amount of dollars is being cut from public health in their budget?
Well, we want to do it before their budget purposes, obviously, and that's why Minister Elliott was very clear that those technical tables that we set up for both public health and emergency services is going to continue. We want to make sure that we have experts in the municipal field at the table working with us, and I know that both Mayor Watson and Mayor Tory understand that we want to do this in a collaborative vein, that we want to make sure that we slow down and have those valuable discussions before they set the 2020 budget, and we're going to do that.
Do you regret not doing that the first time around? Do you regret that the impression left was that you were not collaborative?
Well, the one thing that I do want to say in terms of those three issues, the Premier set the pause for a very good reason. He wanted to take the time to actually slow things down and have that conversation, and to be able to press the pause button on the 2019 budget. Now in this conference, not only have we provided some certainty in 2020, but we've also delivered on many of the things that municipalities wanted. They wanted to have some certainty for 2020 for the Ontario Municipal Partnership Fund. We did that today. They wanted the community and recreation stream of infrastructure to be open. We gave that certainty today for September the 3rd. We've given them cannabis money that they've asked for. We've moved forward on municipal modernization money to the tune of $200 million, and we've got over 90% of those large urban communities that have signed on for our Audit and Accountability Committee, or Accountability Fund. No one can say that we haven't listened, and no one can say that we aren't collaborating. This is the way we're going to move forward, and I think if you came down and talked to some of the delegates on the floor, they would agree that there's a partnership attitude and atmosphere at this conference, and people want to work with our government.
The Premier also promised a transitional fund in his speech earlier today. What exactly is that?
Well, again, we'll work with our municipalities for the two services that I mentioned, being public health and the fact that we've taken the funding issues for emergency service and paramedic services off the table. Obviously, we now realize that the child care piece will be now phased in over a 3-year period. And again, we've got time from now till the budgets are set this fall to actually have an engagement and have some technical tables, some conversations, some dialogue, which is what municipalities have always said from us, that if you can't give us the money, at least give us the time. We've tried to do both.
Sorry, I'm asking specifically, though, what is the transitional fund? Is that a pocket of money that you've put aside to mitigate some of the hit that the municipalities will take? And if so, what is the size of that funding?
Correct. So let's use public health as an example. When we say that no one municipality will have more than 10% reduction, if there are funds that need to be provided as part of the transition to make sure that they get to that level, we're going to be doing that. The same thing with some of the other public services.
And
so
what is the maximum amount of
work with them?
Money that you have to offer in that situation?
Well, it will depend on the municipality. We, again, want to use the opportunity to sit down with municipalities to talk about. But the Premier's been clear. We are going to provide that funding. Many municipalities have come forward, obviously want to see details. Minister Elliott, in her speech, provided some of those details, and we'll continue to sit down with AMO, who are very eager to have those discussions.
I take your point that it's obviously on a case-by-case basis, but I'm thinking here as a matter of scale. You know, if a municipality says we're $60 million short versus $2 million, is there an envelope of funding, a maximum amount that your government is willing to provide, maybe in total? The Premier has indicated that there will be transitional funding. We will work from now till the municipal budgetary cycle, which is this fall, to sit down and work, and we'll establish that fund with municipal consultation. So no money has been allotted at this point?
We have made a decision to allot money for the Municipal Transition Fund, but again, I want to do it collaboratively.
Okay, I'll leave it there, sir. Thanks a lot, Minister Clark. Appreciate your time today. That's
Thank you.
Ontario Minister of Municipal Affairs, Steve Clark.
Thanks very much.
Hi. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video. Thanks for watching.